Okay. The May 23rd, 2017 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mrs. Brown? Here. Dr. Carbone? Here. Mrs. Conley? Here. Mrs. Draw? Here. Ms. Harris is excused. Mr. Hebert? Here. Mr. Lightfoot? Here. Mr. Moyo? Here. Chairwoman Taylor?
Here. And welcome Legislator Moyo to the Human Services Committee. Is there anyone signed up for public forum?
There is not.
Is there anyone present who is not signed up to speak who would like to address the committee at this time? Being none, Rochelle Bell, Senior Environmental Planner of the Planning and Development Department, will now give a brief overview of the 2018 to the 2023 Capital Improvement Program as it pertains to the Human Services Committee.
Thank you, Madam Chair. There are two sections of the CIP pertinent to this committee. The medical examiner in the Department of Health is found on page 11 of your CIP. The medical examiner's program maintains 6 pieces of equipment. Cost increases from last year's CIP are due to a modest increase in funding needs and shuffling the equipment replacement costs. The Monroe Community Hospital begins on page 17. The projects in this year's CIP are the same as last year, though funding needs increased modestly for the first 4 projects. I'll be happy to take questions when you get to this item on your agenda. Thank you.
Thank you, Ms. Bell. The next item is the approval of the minutes. You have the April 25th, 2017 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Madam Clerk.
Referral 17-0159.
Moved by Legislator Brown, seconded by Legislator Conley. Is there any discussion? Yes, Legislator.
Thank you, Madam Chairwoman. Is just as a clarifying question, is this the time to ask questions about the CIP? Is that correct? That
yes.
You just mentioned. Okay, thank you. Through the chair and to the administration, I have a question that's outside of the 2 pages that you referenced. Was there any consideration of renovations or repairs that might be done to 691 St. Paul Street, where part of the Department of Human Services is located?
Through the chair, county legal has opined that the county may not expend county capital dollars on non-county property. 691 St. Paul is a leased building. That matter is, I'll say, complicated a bit by the fact that the lease does obligate, for lack of a better term, the county to do certain improvements leaseholder improvements to the building. At this point, said leaseholder improvements that we're contemplating, we are considering such using general county funding and/or potentially operating funding, and those are conversations we'll have and clarify with legal before expending said funds.
Okay, thank you. And I reviewed the lease and I read it in the same way that you're stating. That's the legal opinion that you're quoting. Is that something that I could be provided with in terms of just in paper form? Through the chair, excuse me.
Through the chair, yes.
Okay, thank you.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 17-0166.
It was moved by Legislator Connolly, seconded by Legislator Draw. Is there any discussion? Yes, Legislator Lightfoot.
Thank you very much, Madam Chair. Madam Chair, through you to the administration there, I see that this two new companies were selected from the request for qualifications, Adico Medical and Science Staffing Incorporated. Are these two new contractors in addition to or as opposed to the old grantees of Maximum Healthcare Services or Nurse Finders LLC?
Through the chair, these were done through an RFP, and so we currently have a contract with ADECO, and this is an amendment to add to the contract so that we can increase some services.
So instead of the two that we had from the previous contract, we'll have additional two, so it'll be a total of 4?
Through the chair, no, sorry, it's the same companies that we initially accepted following the RFP. It's just that as things turned out, ADECO came to the forefront as the agency who was best able to supply us with most of our services. And so we have leaned heavily on them, and that's why we're adding them to this contract amendment.
And so are we discontinuing, we never really had a relationship or services provided by one Maximum Healthcare Services? Through you, Madam Chair, to the administration.
Through the chair, we continue to have a contractual relationship with them in case we need a surge of services. For example, if we had a communicable disease outbreak, but they do not provide us for our routine everyday service.
Is this the same for you, Madam Chair, to the administration? It's the same as of Nurse Finders as well, LLC?
Through the chair, yes, correct.
So, through you, Madam Chair, there's an increased need of more funding. As why do we need more funding?
Through the chair, we have a vacant public health nurse position that has been assigned for a number of years to the lead program to do follow-up with high lead levels in children. And that person retired recently, and while we are we're actively recruiting to fill that position, but during that time, we need to continue to follow up on the lead labs that we receive every day. And so through our contract with ADECO, we were able to secure a pediatric LPN who's able to screen the labs and refer them on to a registered nurse supervisor so that we can provide the follow-up that the children need.
Okay, thank you very much.
Any other discussion? Yes, Legislator Conlon.
Thank you, Madam Chair. Through you to the administration. Is the nurse stationed at Starlight Pediatrics?
Through the chair, no, the nurse is stationed at 111 West Fall Road where the rest of the lead program staff work.
Thank you. And through the chair, is there nursing staff provided to Starlight Pediatrics through this arrangement?
Through the chair, there is in fact one pediatric LPN who is assigned to Starlight Pediatrics 20 hours per week.
Thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Is there any opposed? Item carries. Next item, Madam Clerk.
Referral 17-0167.
Moved by Legislator Draw, seconded by Legislator Heber. Is there any discussion? Legislator?
Thank you, Madam Chairwoman. Through you to the administration, are there statistics regarding how many people were treated under the rabies program in 2016?
Through the chair, we have the number of animals that were vaccinated, people treated, and the incidents that we responded to, as well as the number of animals that we submitted for testing.
Thank you. Through the chair, could you tell me could you tell me the number of people who were treated in 2016?
Through the chair, I did not, but I certainly will. We
Oh,
had
okay.
134 people treated for post-exposure prophylaxis.
Okay, thank you very much. And excuse me, through the chair, is that an increase or is that about average for the past 5-year period?
Through the chair, we actually have data from 2014 to 2015. That's actually an increase. From 2014, we had 86, and 2015, we had 107.
Okay, thank you. Through the chair, is there a reason for a 40% increase, 50% increase?
Through the chair, we actually had in 2016 more animal incidents that we investigated, and as a result of that, there was an increase in the number of people needing treatment.
Thank you. So through the chair, just to clarify one last thing, do you think it's people becoming aware of the county services, or that there's more exposure to rabies?
Through the chair, most likely more people aware of the need and more physicians aware of the need to report the incidents.
Okay, thank you.
Any other discussion? Being none, all those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before this committee at this time? There being no other matters, the May 23rd, 2017 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be held on Tuesday, June 27th, 2017 at 5:30. Thank you.